Kyla, Bruno, and for today I'm going to demonstrate to you on how to do the proper procedure on how to insert and remove female catheter and also getting the urine sample. Prior to performing the procedure, you must also verify the physician's order for the catheter insertion. Then introduce yourself and verify the client's identity using agency protocol and explain to the client what you're going to do, why it is necessary, and how she can cooperate or participate. The rationale so that the client will be aware as you do the procedure. Good day, ma'am. I'm Kyla, Bruno. And what is your name? Okay, ma'am. I'm your student nurse, and we are going to insert and remove afterwards the catheter. And also, we will get your urine sample for the whole procedure. Is that okay to you, ma'am? Okay, now we will perform hand hygiene and put on gloves and also observe other appropriate infection control procedure. The rationale to prevent the cross-contamination. So, also provide for the client's privacy, the rationale so that the patient will be comfortable during the whole procedure. Now for the assessment, so, okay. Ma'am, I'm going to assess you, is that okay? Okay. Ma'am, may I ask kung kailan po yung last urination niyo po or yung pag-ihi niyo? Okay. So, how about your last catheterize po? Kailan po kayo last na catheter? Is that okay if I percuss your abdomen po? Thank you, ma'am. So, i-expose lang po natin yung abdomen niya. Is that okay? Expose na po natin. Set na po akong mag-percuss. Okay po. Tapos na po, ma'am. So now we are going to assemble the equipments and supplies such as a sterile catheter of appropriate size, 1 to 2 pair of gloves, waterproof drapes, antiseptic solution, cleansing balls, forceps, water-soluble lubricant, urine receptacle, and specimen container. For an indwelling catheter, you should have syringe refilled with sterile water amount specified by other catheter manufacturers. Collection bag and tubing, 2% silicone gel. If the agency permits, then disposable cleaning gloves and sterile gloves, supplies for performing perineal cleansing, bath blanket or sheet for draping the client, and also obtain a penlight or goose lamp if it is necessary. And we will also perform routine perineal care. So for the whole procedure, you should position the client into dorsal recumbent position. So, ma'am, higa po tayo ng maayos na po. Okay, thank you po, ma'am. After positioning the patient into dorsal recumbent, observe proper draping, inspect perineal region for erythema, drainage, and odor, and also assess perineal anatomy, and also you should apply clean gloves upon examining. But first, we need to place waterproof pad under the patient so that it will prevent soiling of bed linens. So, ma'am, maglalagay lang po tayo ng waterproof pad sa sa baba po ng tiles, dati po, para po hindi po madumihan yung higaan nyo. Thank you po, ma'am. po natin yung paa natin ng onti lang. Tapos, ito tayo po. So, also cover the patient with sheets and expose only the perineal area for the procedure. So, ma'am, remove na po natin yung pants nyo. And don't worry, dahil i-expose lang po natin yung area na kailangan para sa ating procedure. Is that okay po? Tapos ko na po yung dress niyo, ma'am. So, now we are going to start inspecting the perineal area of the patient. Okay? So, ma'am, i-inspect ko lang po yung perineal area po ninyo. Okay. So, as I inspect, the patient perineal area has no lesions or lumps. There are also no abnormality as I observed. Okay? So, the rationale assessment of perineal area allows you to determine perineal condition and position of anatomical landmarks to assist with insertion. Now we are going to wash the perineal area with water and soap or perineal cleanser according to agency policy if it is needed. So we're going to use the washcloth. And paint with cotton balls with better than following the proper stroke, top or bottom inner to outer stroke. The rationale cleaning removes any secretions, urine, and feces. And also it reduces the risk of infection and proper stroke of cleaning, prevent cross-contamination. Okay, now we are going to gather supplies within reach. The rationale preparation ahead of time enhances the patient comfort and safety, and also it will minimize time and effort. So now we are going to check for the size and type of catheter and use the smallest size of catheter as possible. The rationale, larger catheter size increases the risk of urethral trauma, or so choose the smallest catheter size as possible. So if you are using collecting bag, do not contained within the catheterization kit, open the package and place. The rationale, connecting the urine bag prior to the insertion minimize contamination. And also, make sure that you have adequate lighting as you perform. The rationale is so that the adequate lighting helps with accuracy and speed of catheter insertion. Now we are going to remove the gloves and do the hand hygiene and open the catheterization kit. Okay. The rationale, these steps ensure preparation and organization for procedure, and also it will maximize time and effort. So as you can see, na-open na po natin yung catheterization kit, and we will now apply sterile glove using sterile to sterile technique. inflation using a sterile syringe by removing the cap on the tip of the syringe and attached syringe pre-filled with sterile water to injection port and inject appropriate amount of fluids, and if balloons withdraw fluid and if balloons inflates properly, withdraw the fluid and leave syringe attached to the port. The rationale to ensure that the balloon is not leaking. Papakita ko lang kung paano siya nag-ano. So, lumalobo naman siya. Ayan. Ayan. Okay. So, also, add lubricant, placing on the top of the glove dominant hand and lubricate 1 to 2 inches of the catheter tip. The rationale, lubrication minimizes urethral trauma and discomfort during procedures. So, this is our lubrication. Lalagyan natin dito. And then, i-lubricate po natin yung i-lubricate po natin itong ayan. So, i-lubricate natin siya. So, now we are going to pick up the catheter with dominant hand and roll it in the palm. So, ayan. Okay. So, the rationale, holding the catheter closer to the tip will help to control and manipulate a catheter during insertion. And also, we are now going to insert the catheter by asking the patient to bear down gently to help expose the urethral meatus. So, the dominant hand and hold the catheter, the dominant hand hold the catheter to 7.5 centimeter until the urine flows from the catheter, then advance an additional 5 centimeters. Also, take note that if the urine does not appear in the female's patient vagina, then also take note that if the urine does not appear in a female patient, then you accidentally insert it into the patient vagina. Okay? Ma'am, ready na po tayo. Hinga po tayo ng malalim. I-insert ko na po sa inyo. Okay po. Sabihan niyo po ako, ma'am, kapag nakaramdam po kayo ng any pain or irritation po. So, ulit lang po, ma'am. Hinga po mo ng malalim. Okay po. Masakit po ba, ma'am? Isa pa po, ma'am. Hinga po malalim. Okay. Isa pa po, ma'am. So, then slowly inflate the balloon using a prefilled syringe. The rationale, the size of balloon is marked on the catheter. So, we're going now to inflate the balloon. Amilain ko lang po saglit ha. Okay. Okay naman siya. Okay. So we are going to secure it under the patient. So that's how we insert female catheter. Now we are going to collect urine specimen if required. The rationale it may be required for an analysis to collect as for agency policy. So ano nga ba yung una natin gagawin? We are going to clamp the urine tube. So let's imagine na nakaklamp na po yung urine tube. And we are going to clean the urine port with wipes and then put the syringe without the needle in the port. So for example, this is the clean wipes. And then you are going to clean the urine port. So, and now we are going to get the required urine sample. After that, clean the urine port again and put the urine sample in a small specimen clamp. So now, syringe. So, ito na po yung nakuha natin urine from the patient. And now, ilalagay na po natin siya sa may specimen cup. Then discard. And then also, we need to put the name of the patient here in the cup. After getting the urine sample, of course, you should also clean again the urine port with wipes. So you will get a new wipes and then clean again the urine port. And discard it. So, now we are ready to remove the catheter. But first, you need again to verify the doctor's order or kailangan pa natin ng signal ng ating doctor. So, ma'am, i-remove na pa natin yung inyong catheter. Ready na po ba kayo? Okay, so, we are going to use the syringe to remove the fluid from the balloon and pinch the catheter and pull it out smoothly in a rotating motion. after getting the sterile water inside the catheter, we will with your free hand catch the end of the catheter with tissue and wipes. So, ma'am, hinga po tayo malalim. Okay. So, for example, this is our tissue. Okay. Hilain na po natin, ma'am. Okay. And discard. Okay. So that's how we remove the catheter in the patient's private area and also render care to the patient and measure urine output and discard urine in the toilet. So dispose of all the disposable supplies following agency policy, and also remove your gloves and do the hand hygiene. So, ang rationale natin, again, to reduce the transmission of microorganisms. Document the procedure according to agency policy, including patient tolerance of procedure, any unexpected outcomes, and urine output, including the urine character and the color. So, ma'am, thank you po sa inyong cooperation. Yan, expose na po natin ang inyong private area. So that's how we remove the female catheter from the patient.